Hello all. In this video we will see about one of the important aspects of preventive orthodontics, that is space maintainers. Preventive orthodontics, as the name suggests, in simple terms it believes to prevent a problem before it occurs. For example, space maintainers are used when there is premature loss of primary teeth. The space need to be maintained before the permanent teeth erupts in the allotted time for it. So the space maintainers maintains the space, thus avoiding crowding in the region. Space maintainers are appliances used to maintain space and guide unerupted tooth. And as by classification, they can be either removable or fixed space maintainers. Removable space maintainers can be either classified as cast partial or rod partial, or they can be classified as active appliance or passive appliance, functional appliance or non-functional appliance, depending on whether the missing tooth is replaced by a pontic or not. And fixed space maintainers are classified as banded appliance or bonded appliance, passive or active appliance, functional or non-functional appliance. Today we will see about five major fixed space maintainers, first being band and loop. Band and loop appliance is used in premature loss of primary first or second molar. Mostly it is used in unilateral cases, rarely in bilateral cases. And when the permanent premolar is unerupted and takes at least 2 years to erupt. You can confirm that in radiograph by whether the root length is less than half of the expected root, so that you know that after eruption root takes 3 years to get completed for a permanent tooth. So if the root length is less than half of the complete root length, then it takes at least 2 years to erupt, and in such cases band and loop is used. Contraindications include high caries activity. As you could see, the sites where the tooth is bonded is prone for caries formation, and space loss can occur since it is attached to one side only. Here just takes the support of the tooth, and in crowding you cannot use this space maintainer. You need to go for space regainer. And limitation is that it cannot be used for more than one tooth. Even if it is used, it does not give very good results. And loss of E before the eruption of 4, in cases when E is also lost, but 4 has not erupted yet, you cannot use it as a support. Even if 6 has been erupted, the loop will be a really long one to use. And non-functional appliances, since the pontic is not present here, and it is semi-fixed, that is, as I said, it is bonded or banded to one side only. The other side it is just taking support on the other tooth, and therefore it is semi-fixed, and the loop can migrate gingivally on the semi-fixed side. There are many modifications for band and loop, including band and bar, crown and loop, and extended band and loop. The second form of space maintainer is the lingual arch. As from the name you could see, it is used in mandibular arch when there is bilateral loss of posterior teeth, and it is used in mixed dentition. As you could see from the picture, the support is taken from the permanent first molar, that is 6, and minor tooth movement is possible in this appliance. Therefore, space regaining is also achieved here. Leeway space is maintained. Do you have a doubt of what is leeway space? Comment below. I will make a short video on that. Contraindications include before the eruption of mandibular incisors. As you could see, it takes support from the mandibular incisors. Limitation is that it may cause movement. As we are also using it for space regaining, it could also act as a limitation. When the space regaining is not needed, it may cause unnecessary movement. A loss of cementation or loss of solder can lead to failure of the appliance, which needs repair. And the next space maintainer is distal shoe space maintainer. It looks like a band and loop, but you could see the differences here. What is this, and what is the indication for this? The important indication is that early loss or removal of E, that is the second primary molar, prior to the eruption of 6. When 6 is yet to erupt, you have to use an eruption guiding appliance so that it will bring the 6 into its normal position like this. So this eruption guiding appliance is known as the distal shoe space maintainer. The name is from the distal shoe like extension present here. It is also known as intra-alveolar appliance. As you could see, it is invasive into the gingiva. It is radiographically confirmed, the position is radiographically confirmed, and you should also rule out any missing 6, because then the purpose of giving a distal shoe is completely unnecessary. And as you could see here, the contraindication is that congenitally missing 6 and poor patient or parent complaints, as it could be painful in the initial stage, and medically compromised patient where the patient has bleeding disorders or congenital heart disease or rheumatic fever, then this kind of intraalveolar appliance is contraindicated. The limitation is that overextension can cause injury. You have to evaluate with radiograph for proper placement of the distal shoe appliance, and under extension, the 6 will tip into the space. So you have to extend it properly. Extraction socket, it will interfere with the complete epithelialization of the extraction socket. And the next space maintainer is the nance palatal arch. Nance palatal arch is usually when there is bilateral loss, as you could see here, and it can be combined with habit breaking appliance. For example, if the patient is having tongue thrusting habit, then you could include palatal crib at this place along with the nance palatal arch. The contraindication is that if there is already some palatal injury or lesion, you have to avoid this. If 1/6 and 2/6 are not erupted, then you have to avoid this. Limitation is that there could be tissue hyperplasia due to the constant contact of this support in the palate, and infection due to poor oral hygiene can also occur. The next one is transpalatal arch, which is similar to nance-palatal arch, but you could see the support is not from the palate here, and the unilateral loss of space is most commonly indicated for transpalatal arch. As you could see, you are taking support from both the molars, and there could be tipping of molar if it is a bilateral loss. Contraindication is bilateral loss. The reason is the both molars may tip together if it is a bilateral loss. Thus, we saw about 5 major fixed space maintainers. The fabrication of the space maintainer and modifications are another huge topic. This video aims to educate you on the 5 basic space maintainers, their limitations, their advantages and indications. Hope you are finding this video useful. See you soon in the next video.